Body Logic Physiotherapy, empowering people to achieve better health.
But I can't imagine that anything is going to exacerbate the pain to the degree that I can't deal with it.
Right. So you feel in control of it?
Oh, totally.
Right. Did you 3 years ago?
No.
Did you 10 years ago?
No.
Did you 20 years ago?
No.
Right. So that's a new thing.
That's a new thing.
Welcome to episode 12 of the Empowered Beyond Pain podcast, proudly brought to you by Body Logic Physiotherapy. This week we discuss Fact 2 from the 10 Scientific Facts About Back Pain research paper published in the BJSM. That fact was...
Getting older is not a cause of back pain.
Although it's a widespread belief and concern that getting older causes or worsens back pain, research does not support this, and evidence-based treatments can help at any age. So in today's episode, Pete and I sit down with Jan, who is proudly 77 years young and had a 40-year history of back pain and sciatica, which, as you will hear, took her to some very dark places, which is unfortunately quite common for people with persistent pain. Luckily, her optimism and dedication combined with finding the right coach a few years ago, and life has been much richer since. Now, before we start today, the topic of suicide does come up in this conversation. Suicide takes the lives of 8 Australians every day, more than double the road toll, and it's the leading cause of death for those between 15 and 44 years old. 75% are male, and the suicide rate in Aboriginal and Torres Strait Islander people is twice that of their non-Indigenous counterparts. It's important to remember that if you're thinking of suicide, you are not alone and help is available. Please tell someone you trust today. If you're in Australia, the lifeline number is 131114 and they're ready to help 24/7. Persistent pain is associated with higher rates of suicidality, so this is something we take very seriously. As always, show notes for this episode are available at www.bodylogic.physio/podcast. And if you found value in this episode, please let us know via Twitter, share it, subscribe, and if you're feeling extra generous, rate and review. We'd also like to let you know that we'll be moving to fortnightly releases of the podcast, so every other Saturday. But for now, on to today's conversation. So Jan, welcome to the podcast.
Thank you.
First of all, can we start by you introducing yourself?
Yes, my name is Jan and I'm 77 years old. I've been retired for about the last 15 years, but I'm a very active person.
So can you tell me your story with your back pain then?
Yes, I don't want to sound melodramatic, but my journey with chronic lower back pain and sciatic pain has been a hell of a journey. And I look upon where I am at now, at my age, when I've been told I'm going to wear out, that I'm as active as I am, and I seem to have, although I haven't found a panacea, I've got the skills to deal with the pain.
Now you've had one hell of a journey, so can you talk me through the processes that you've been through?
The processes, God, I've had everything known to man. Perhaps
How did it begin, Jan?
How did it begin? Okay. I attribute my first really acute back pain from a fall off a bus when I was 19 years old. I green stick fractured my wrist, and all the consultant was interested in was in fixing the wrist, and he wouldn't even listen to me when I said my back was sore. So I think it was perhaps a bruised coccyx or something, but it was always from that time onwards, always my lower back was irritated on sitting. Then, but of course at that age, at 19, I was indestructible. So over a period of about 40 years, both in the UK and in Australia, I've had bouts of non-specific back pain, varying in degree, varying in length of time. not bad enough for me to take time off work, but popping pills and trying to keep active, but without any aim in view, just to keep it at bay rather than to try and fix the problem, just keep it to the level where I can manage. Obviously, during our lifetime, we do things which we're told our back is fragile for a start, but we do things. I mean, I'm a very keen gardener, so I've lifted things that are too heavy. I've been in the garden perhaps for a long time, so my back has got so stiff. But I have learned that excessive sitting is the key factor for me. And what sort of job did I do? I was in human resources. I was interviewing, counselling. I was sitting all day.
Okay, so can I just ask you, Jan, across your journey, have you had much treatment?
I'm sorry, I don't mean to laugh. Have I had much treatment? I think there's a curiosity factor here. I think when you present to a practitioner, because of their duty of care, they seem to think that the more expensive the treatment, the more in-depth the treatment, the better the treatment. So what have I had? I've had MRIs, which I believe are global. But there are certain practitioners who will not treat you without an MRI. That's their first route. You go to the GP who sends you to someone else who then wants you to have an MRI. I've had a myelogram. All of them proved pretty inconclusive. Then there was the theory that I had conjoined nerves, L45S1, which another MRI a few years later disproved that. So here's the patient, confused, doesn't know the implications of it. I've had nerve root sleeve injections, I've had facet joint injections, I've had nerve blocks. When I had one of the nerve root sleeve injections, although it was under X-ray control, they hit the nerve, so I levitated. So for 2 days I was useless. Ongoing treatment, chronic pain specialist, physio twice a week, which I then...
What kind of treatment was that?
Manipulation.
Was that helpful?
Not terribly. It was soothing. You feel like you have to be active with your own treatment. You feel that you've got to be doing something. You've got to be pursuing something to resolve it. If not, you just get resigned, and there's a difference between acceptance, accepting something, and resignation. So
what were the kind of diagnoses that you were given for this problem?
What were the diagnoses? For heaven's sake, did I ever get a diagnosis? I don't think I ever got a real diagnosis. The last person I saw, which made me think this is enough, the last person I saw had an MRI done and had looked at it and said, "Oh, I think we could tidy things up a bit here." It was like having a haircut.
Right. Yeah, okay.
And I was at that stage. I was being offered nerve blocks and rhizotomies.
Right.
And we all do anecdotal stuff. We all do Miss Dr. Google. And you have to be extremely careful because everyone's case is different. But when he offered me the rhizotomy, went home and I talked to a guy that I respected a great deal, and he'd had 3 rhizotomies. He said, Jen, the third one I had, I said, no more, because by the time I'd left the hospital and got into my car, the pain was back. So I was looking, and I think all pain sufferers look for a panacea outside of themselves. They cannot believe that there is a way within ourselves to tease out what are the things that are beneficial, what are the things that are aggravating. And I think until you can work that out, the pain will continue to be there.
Okay. So I'm really interested in that, the fact you've had back pain for most of your life, since the age of 19.
Yeah.
And what were you thinking when you were younger you would be like when you're at this age?
I was thinking, look, I think when you're young, you do feel you're indestructible. I don't think...
What was the age when you started to be concerned about
I suppose...
how you would be at this point in your life?
Well, I don't know if this has any relativity to it, but as a woman, it was at menopause that I was most worried about it. And also, I didn't have a very good role model in the fact that my mother had very debilitating rheumatoid arthritis.
Right. Okay. So you saw a picture of someone who wasn't...
Yeah, so I saw a picture of this tall lady who did everything she could to help herself, but was in a corset with bones in, like that, steel bones in a corset. Yeah. So I'm thinking to myself, oh hell. So I was around my middle 40s.
Okay. And did you have any healthcare practitioners who gave you the expectation that you would get worse with age?
Yes, I think since being in Australia, I saw a medical practitioner, a neurosurgeon, and he said, there's some disturbance here, but it's not quite clear what it is. And at that stage, they were thinking that I had conjoint nerves, and the nerves were perhaps touching together as they came out of the socket. He said to me, I'd like you to, I don't want to concern you too much, he said, but I'd like you to go away. He said that this will inevitably degenerate with time. So every time I've had an MRI, they say, oh, disc degeneration. Well, I'm sure everybody, as they get older, has disc degeneration.
But you were thinking that was going to result in you getting worse with time? Yeah.
Yes.
And was there any mention of wheelchairs?
Yes. He said, the neurosurgeon said to me, he said, go home, he said, there will be a time when you'll need to be in a wheelchair.
Right. How did that make you feel?
Powerless.
Powerless?
Yeah. Powerless.
Did you feel like that was something that was going to happen to you?
I felt like... No, I don't think I did. I thought, I'll show you.
Right. Okay.
Even at that time, as far as possible, I remember taking a job, and the director said to me, he said, well, our hours are 8:30 until 5 o'clock. So I didn't say anything during the interview, and I thought, 8:30, no, that's not going to work for me. I have to say I want to be there at 8:45. I am going to the gym. I don't care what happens. I would have given away the job rather than not be
So
able
there
to
was
go to the
something
gym.
in you. Is that someone had told you to do that? Was that within you that you made that decision?
No, I knew that I made that decision within myself.
So it wasn't a healthcare practitioner that told you to do that?
No. I knew that I couldn't get through the whole day sitting down unless I got my body moving at the beginning of the day.
Okay, got it. So you worked that out for yourself. You're your own detective.
Yes,
Right.
I worked that out for myself.
Okay, so so that picture that you paint is of that kind of around the mid-40s period where you were thinking, my God, this is going to get worse.
Mm-hmm.
And what was you had your mum, which was that kind of like not a good role model of that she had a different problem.
Yeah.
And you'd also been given some scary information around the scans of the degeneration was going to get worse. So you were thinking your body was going to get more and more frail or more vulnerable, or
I thought
could let you down with age.
My body could let me down.
Right. And so you were like, I'm going to try and keep as fit as I can to try and limit that inevitability.
Yes. So, as a measure to sort of circumvent that, I thought, now what transferable skills do I have? Because I have no children, right? So I've always been a career woman. I've always worked. I thought, now, what transferable skills have I got that I can change my occupation without changing my occupation? So, someone said to me, you've done public speaking. I said, yeah. They said, could you do some presentations for us? So then I became a trainer and I could stand up doing that.
Yeah.
So I was able, with the combination of the gym, during periods when it wasn't flared up, combination with the gym and standing up all day, I was able to reinvent myself.
Right. So if you look back 3 years ago, say,
Yes.
and you look at to where you are now,
Yes.
are you better or worse?
Oh, I'm better than when I was 3 years ago.
Okay, so you're 3 years older,
Yes.
you're closer to 80, and you feel better.
Yes. Much.
So that goes against the idea that you're going to get worse with age.
Yes.
So why are you better? What's made you better?
What's made me better?
Even though you're 3 years closer to 80. What's different? Because your body's 3 years older.
Okay. What's different is I've given myself permission to give some people the flick. Look, my social network is very important to me. But being a compassionate person as I am, I found that other people wanted to dump all their stuff onto me, and of course I accepted it all. And then there's no debriefing. So if you don't debrief and get rid of it, you're overwhelmed by it.
So did that affect your pain?
It was a burden. It was.
How did that impact on your pain then?
I can't put my finger and say, oh, look, I was talking to so-and-so today and my pain got worse. I can't. I can't pinpoint it in that way. But I can say I didn't sleep well because I was thinking about the things.
Okay.
And I do know that for me, good sleep is important. Critical.
So those social interactions disrupted your sleep,
Yes.
which then disrupted your pain.
Yes.
So it was kind of like a step process, right?
Yes.
So what else is different? So you're protecting your social world
Yes.
to ensure that your sleep is good, so you
Yes.
don't carry everyone's burden.
Yes.
What else is good? What else is different?
I do meditation.
Okay. What's that do for your pain?
It's very calming. My husband is a very good leveler for me because just sitting next to him, not touching him, just sitting next to him on the sofa, I feel that his calmness can help me. So by transferring it to meditation that I can do anywhere at any time, in whatever state I am, just eases me and distracts me. It's another distraction.
Okay.
I do colouring in books.
Yeah, great. Okay. But I think 3 years ago you were with your husband, weren't you?
Yes.
So were you relaxing and meditating then with him, or is that a new thing?
It's something that I do, that I have done on and off. When the pain was so bad that I could hardly sit at all. I remember going out for dinner one night, and the pain in my back was so bad that I said to Bob, "Do you think people will mind if I use my cushion to kneel down and just sit at the end of the table like that?" And that's what I did for the whole meal. So then I got to the stage that people would ring and say, "Look, we're inviting you. We understand if you can't come."
Right. So do you think it was helpful when you guarded your back and sat up straight?
No.
Right. Why did you do it then?
Because we're taught about posture, and I have to say, a chiropractor that I've been to, bang, 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 come back on Wednesday, bang, 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 come back on Friday. The people that I've been to have said to me, "You've got to think about your posture. You've got a luxation in your back. You're tense. You've got to protect your core." And yet the latest practitioner that I'm seeing says, "Oh, let that belly go." And it's just like a breath of fresh air, because you go, "Oh."
Right. So you've told me a few things that have changed for you.
Yeah.
The way you hold yourself, your ability to relax, some of your beliefs around your body. Yep.
Yeah.
The way you manage your social interactions, your sleep. What about the way you move? Has that changed?
The way that I move.
Like if you were bending over or picking something up or using your body, do you think that's changed?
Well, I can definitely say that I've always been taught you must bend your knees. You must not lean over from a straight back. You must always protect by bending your knees.
Was that helpful?
No, not at all, because when I did yoga, you bend from the waist and bend forward and bend down and put your hands flat on the floor in front of you, which I find extremely good because it releases all the discs at the bottom of my back.
Okay, so you've learnt to ignore quite a lot of advice on your journey, basically, and it's made you feel better.
Yeah.
In spite of the fact you're older.
Yes.
So if someone said to you, back pain gets worse with age, or I'm worried that it's going to get worse with age, or I could end up in a wheelchair, or if you heard that kind of, the joint's going to wear out, what would you say to them?
I would say to them, be prudent, don't do stupid things like, for instance, there's a box to be moved. Well, I will kick the box and see if it moves, and if it doesn't, I don't bend down to pick it up.
Right.
You've got to be prudent.
Be smart.
But not paranoid. I would also say to them, we're all responsible for our own health. We do know the things that I don't want to say are good for us, but we all know the things that can spark off an episode, and I feel that so many of us are overprotective. I think the challenge for me has been keep moving.
But you were fearful of doing that.
Yeah.
So what overcame that fear? How did you overcome that fear of
By being asked to follow a specific program. Following the specific program, at the end of it, you get results. Well, if you get results and they're good results.
So it wasn't something that was done to you. It was more like a coach who could take you through that journey.
Exactly.
Right. So things that you can do yourself.
Yes.
Right.
So I go back to a couple of times practitioners have said to me, you need to rest. And that seems to be a common thing. Look.
Sounds like rest for sleep's good.
Yeah, rest for sleep, and sometimes when the sciatic pain is so bad, I will say to my husband, I'm going to bed for a couple of hours, I get the heat pack, and that's the rest that I have. But not for days and days and days, because you get stiff and useless. Then you become fearful of doing anything.
So are you fearful of the future in terms of age, in terms of how do you see your future then? Because it sounds like the last 3 years you feel like you're doing more, you've got more strategies to control. It sounds like you've got better control over your pain. You've got tools.
Yes.
Yep.
Yes. What was the question?
So how does the next 10 years look like for you?
Well, I'm a realist. I know I'm not going to be trying to climb Everest. But I'm absolutely convinced that I'm going to be going to the gym on a regular basis. Right. I'm absolutely convinced that I'm going to be doing the things that I want to do, having a social network, going out, eating and various things. The future is day by day. I don't want to predict what I'll be doing in 3 years' time, because I absolutely don't know. But I can't imagine that anything is going to exacerbate the pain to the degree that I can't deal with it.
Right. So you feel in control of it?
Oh, totally.
Right. Did you 3 years ago?
No.
Did you 10 years ago?
No.
Did you 20 years ago?
No.
Right. So that's a new thing.
That's a new thing. And the other thing is, you are always mindful of how it has been, and I give myself I'm much kinder to myself, and I give myself much better self-talk. I go, now Jan, you know you can get through this. It's not as bad as you think. Now, what did you do the last time? Right. I actually.
So you're your own coach.
Talk to myself. Yes.
You're your own coach.
If you put it that way, yes. Yeah. I talk to myself and I go.
In a kind way.
It's not that bad. Come on, you can do this. I have had suicidal thoughts once. Just once.
How long ago was that?
2014, I was in France. The itinerary that we had looked very doable. But I was on planes, in cars, on beds that I didn't know, staying up late at night, all those things. And all these factors conspired that I could hardly walk. I went to a GP who gave me all sorts of opioid drugs and whatever have you. Didn't work. I had a nurse coming home twice a day to give me injections. How I got back to Australia is all a blur. And I thought, I'm never going to that place again. But while I was there, one day my husband had to go, he went off to do some research. And I went into the bathroom, I looked at my wrists and I thought, I'll make a mess of this. And just as I was at the bathroom mirror looking at my wrist, the owner of the apartment, who never came to the front door, knocked on the door and said, I saw Bob go off this morning. I know he's gone out for the day. Would you like to come and have a cup of tea with me? And I thought, well, that was opportune, wasn't it? That saved me doing something I didn't need.
So you were feeling very desperate at the time?
I was feeling totally desperate.
With no strategy to control yourself?
No.
Do you ever think that'll happen again?
No, never.
Right. Okay.
No, never.
Okay.
Because if you think about it logically, what is that going to solve? It's not going to solve anything.
No. But to get into that state again where you feel that desperate.
No.
Because you have the tools.
No. Because I have the tools. Yeah. And I have a coach. For which I am very thankful. Now, I must tell you that at one time I was fearful of, it's a health practitioner, at one time, and I spoke to him about it. I was very fearful of relying too much on my practitioner, but I was assured that he was only my coach and guide. And I was asked when I thought another appointment would be appropriate. Choice! Practitioners do not give choice.
Right. Are you reliant on that practitioner now?
No, I like to see him. I like to see him to be. I'm not reliant, but I like the assurance that I'm still on the straight and narrow, that I'm still on the right path.
How often do you do that?
Well, I've had a little episode lately. I've had a little episode lately where I was moving. So I was up for a walk and I fell over and broke my arm.
Right, okay.
So I've seen him a little bit more frequently than I was gradually being weaned off.
So what does wean look like now for you, frequency-wise?
A wean looks like for me now 6 weeks, 2 months.
Yeah, okay.
But I'm offered the choice. Now, when do you think you'd like to come back? Whereas normally practitioners will say, I need to see you in 2 weeks, ask the receptionist for an appointment.
So that's nice. It puts you in control again.
Yeah.
Have you got questions?
Yeah, I just wanted to, we might explore the shoulder pain in a little bit, but I just wanted to get a really clear idea of your trajectory in terms of your quality of life around your back pain and your function around your back pain. So started when you were 19, and then was it a slippery downhill slope from then, or was it...
No, it was...
till menopause and that's when it kicked off?
No, it was... I lifted... there's a lot of psychological stuff around the episode that I can put my finger on. I was a careers advisor, which meant that I went out and promoted the place that the college that I was working for. And this particular evening, I had taken my display board with me, which weighed 16 kilos, and I had 2 bags of a briefcase and a bag in this hand. It was 10 o'clock at night, it was very cold and it was very wet. And I slipped because I had this great big display board which broke down into sections, but I had 16 kilos hanging around my neck and these 2 things here, and I slipped.
So when was that? How old were you roughly then?
1980s, about 1983 that was.
Sure.
So I was 40.
Was a big spike in terms of your
big spike.
Your pain and functional limitations then. And then it's kind of how you've had episodes since.
Yes.
And in the last 3 years it's actually got better.
Yes.
Now that's quite abnormal for the typical trajectory of back pain. And maybe, from the research perspective, maybe Pete, you can talk about what is the normal trajectory for back pain.
So it's a good question, Kev. We've done lots of epidemiological research to go, in a population, when does it begin? So typically it's very unusual to get back pain before the age of 10. Very unusual. But around the age of 16, 14 to 16, a lot of young people start saying, I've got a bit of a sore back. Around the ages 17, up around 1 in 5 will be reporting significant back pain. Around the age of 20, then that's up and around 30% who'll be reporting back pain where it starts impacting on aspects of their life.
Is that related to technology? Or?
No. So there are lots of factors that can influence back pain. Some of it's lifestyle factors, some of it's stress-related factors. Some of it's how much activity you engage in or not. So lots of things can influence that. But we do know that if you track across time, most people see it that if you've got it at an early age, that's it for you. Now, there are some people where back pain becomes something that is a fluctuating. Others, it can get worse. And part of that can be some of the things that you described to us around getting told scary message or not being informed or not having a clear understanding. So the mind runs wild when you don't have a clear understanding of what's going on. Not having tools in your toolkit that allow you to have control over it, get on with your life, keep active, engage, strategies to dampen down your nervous system rather than wind it up. And unfortunately, that then can escalate over time for some people. And I think you were someone who was probably caught in that cycle where your system was so wound up and you were so guarded and protective, it took nothing to fire you up. And it sounds like your journey has been quite a different one of like de-escalation, of relaxing and moving and confidence and having control over your body. That often, if you don't get that, the trajectory just carries on basically. But what we know from the research is that often you'll see a peak around the mid-40s, and for many people it tails off. And as to why, we don't really know why. But we certainly don't see, what we do know is that there is a group of people going into older life when they're not doing well, they become dependent on opioids, they become very fearful, avoidant, they stop exercising and moving, and that's a terrible situation because it can have major impact on other issues around their health. The key thing with aging is aging well.
Yes.
And that's aging fit, strong, active, in control, all the things that you've pretty much told us. But that's not a common thing that people believe. Because if we ask people in the population, what do they think about back pain? They think, oh my God, if it's like this at 30 or 40, what the hell am I going to be like when I'm 60 or 70? Because that's the common belief out there. And the key thing that we say to people is back pain is manageable at any age. And I think that's the key. At any age, it's manageable. But the best things you can do for back pain are the things you can do yourself. And sometimes you need a coach to help you when you got stuck into a bad cycle.
That makes sense. I just feel with the opioids, I have a very low drug tolerance, and God, I've had hallucinations. Oh, the amount of drugs. Oh, this is the vogue. This is what seems to be the one that people take, so you take it and you're either a screaming lunatic or you're crying all the time. So that was another reason for me. Yeah. That was another reason for me searching out something for me that gelled for me, which didn't introduce chemical.
Right. The other thing that this kind of taps into is this idea that we degenerate over age, and we know our structures change the way they look with time. It's a bit like grey hair or wrinkles or whatever. It's a normal part of just getting older. That's not something now that concerns you, I'm hearing. No. So you're quite confident.
I don't even mind my grey hair now.
You've embraced it day by day. Yeah. But that's the other thing that we know does change. So if you take a scan of someone's back at the age of 45, 80% have so-called degeneration. That's like changes within the disc, or you lose water content. It's a very normal thing, but that can be a really scary thing for people because the word in itself, degeneration, is like I'm degenerating, I'm kind of falling apart, my body's not as trustworthy, and so that's something that has a strong connotation with aging, that people start thinking, oh my God, I'm now getting older and I'm going to, that's the wheelchair. The end point of that is I'm no longer able to function. And that's not something that you're functioning better, but you're older.
Yeah, but I also think there's a certain level of curiosity. Some people don't want to know what there are people who you suggest something to them that could help, and they do it once. For instance, exercises, So I have been so fortunate to have been given specific exercises which I have found I didn't even think I could do the jolly things, but I found that I could do them, and they work. But you've got to keep at it. You've got to be committed. You've got to have goals. You've got to measure the goals.
Great.
Some people, they get a prescription and they take something once, or they do the exercises once. It's not enough.
So the discipline is the other
thing. Yeah. And my father was a military man, and we had plenty of discipline.
Right. So you learned that.
So I'm hearing that discipline is something you'd advise someone, that maybe a colleague of yours who is coming to you and said, I've been struggling with my back pain, or I've got some disc degeneration, or my doctor said I've got disc degeneration or some bulging discs. And that discipline is something that you'd advise them to. What other advice would you give those sorts of people if they're coming to you saying, my back's just wearing and tearing, it's going to get worn out as I get older? Because those were the messages that you were given, right?
Yeah.
And you didn't go down that path.
Yeah.
So what advice would you give to your colleagues?
I was very fortunate that I happened to hear about some research that had been done, and I was able to evaluate it in terms of my own back pain. So what I would say to people is, be curious. Don't believe all that Dr. Google says. There's a lot of anecdotal stuff out there. But if you want to, and you've got to be careful about joining self-help groups. Because we can all whinge together. But someone you respect, talk to them about it. What did they find helpful? Talk to a practitioner. Talk to a practitioner who doesn't want to keep poking and prodding you. Talk to a practitioner who can give you some evidence.
So that's about demanding evidence from your practitioner.
Yes.
And demanding management.
Yes.
Skills.
Yeah, skills.
Training, yeah.
What do I do? I remember my husband used to go away a lot overseas. What, do you think my back pain was worse then? But I also started waking up in the middle of the night and shaking. I had no idea what it was, but it was frightening. Anyway, I went to the doctor. I said, this is unusual, and he gave me a little book. He said, look, I'd like you to take this home. I'd like you to come back and see me in a week. So I read the book avidly, took it back, and he said to me, did you relate to any of those symptoms in there? I said, the whole book full. He said, you're having panic attacks. So to me that was just so helpful. But I realised that with back pain there isn't one. Everyone is a different case. Everyone is different. Everyone is an individual. What aggravates me might not aggravate someone else.
So it's got to be tailored for you.
Yeah.
But I think you touch on another thing that's really important, and that's around trusted sources of information. And we know there are some really, really trustworthy websites out there like Pain Health, and I'm really happy to push that. So the Pain Health website is government funded, West Australian government funded, and it puts up evidence-based health information. And that's a really important resource, because there was a study done recently that looked at the accuracy of a lot of the back pain information on the website, and it's not most of it's not accurate.
On the general website.
On the general internet. If you Google back pain, you look it up, you'll hear some scary stuff around your back's worn out. But Google number one, I think, is back pain's caused by degeneration of the disc, and it's going to wear out with time. Well, that's the very thing we're talking about today. And unfortunately, it perpetuates the myth.
Yes, I think you've touched on something that I thought about, which was education. Okay, I want to buy a new TV set. Do I just go in and see that one in a box and just say, well, I'll take that one? No, I go, what size can I have in my lounge? What does it do? How easy is it? I do some research. Well, my health is I can't replace it. It's the one thing that I have that I need to have some control over. I can do the exercise and all that, but be curious. Educate yourself about it.
And that's what this podcast is for, actually, is to take, people like us who work in the research world and to try and make it sensible, logical, understandable for people who live in the real world.
Yes.
That's what this is about.
I'm really passionate about it because I would never want anyone to go through all the pushing and prodding and cranking and pushing and all the drugs and treatments and it's endless. It's fatiguing. We know it's not life-threatening. It's fatiguing. It's time-consuming. It's inconvenient and it's expensive.
Good summary.
That's a really good summary. I think we can probably leave it there. Absolutely.
Awesome. Thank you so much, Jan, for sharing your story.
It's a real pleasure.
So there you have it, the end of another episode. Thanks again for tuning in, and if you want more information, please head to the show notes page for episode 12, which is www.bodylogic.physio/podcast. Now, as you heard, the topic of suicide did come up in this conversation. If you're having suicidal thoughts, please remember you're not alone and help is available. We implore you to tell someone you trust, and if you're in Australia, Lifeline's number is 131114. Next time, which as we mentioned will be in 2 weeks as we move to fortnightly releases, we tackle back pain myth number 3. Now, we're incredibly excited to bring you a conversation with Professor Rochelle Bookbinder. She's a rheumatologist in Melbourne and is one of the authors behind the infamous Lancet series on low back pain. She is truly a world-leading authority, and we had a really insightful conversation which we cannot wait to bring you. But until then, remember to ask, is there more to pain than damage? Please note, what you heard on this episode of Empowered Beyond Pain is strictly for information purposes only and does not substitute individualised care from a trusted and licensed health professional. If you would like individualised, high-value care for your pain, sports or pelvic health problem, head to the Body Logic website and make an appointment. Theme music generously provided by Fervin and Cash.